Hi everyone. So today in this video we will be discussing about adverse drug reaction. So the adverse drug reaction, they are unintended harmful events which can be attributed to the use of medications, and they are significant. They have like a very important role to play in healthcare burden, and they even affect patients' outcomes and increase even the cost. So there are different types of adverse reactions. This can be classified into different types. Let me share you my screen about the different types of adverse reaction. So here you can see how this adverse drug reaction is classified into many different types, like type A reaction. These are predictable and dose dependent, and they are often like an extension of the drug's known pharmacological effect. And type 2 reactions, these are unpredictable and they are not dose dependent. Often they involve immune mediated hypersensitivity. Third is type C reaction. These are chronic effects that occur with long-term use. So if you use certain drug for long term, that can have this type C adverse drug reaction. There is another one that is type D reaction. These are delayed effects, and for example, such as carcinogenesis. Some drug can cause cancer, and that is characterized as type D reaction. Type D ADR. So common adverse drug reactions, like most frequently, for example, gastrointestinal disturbances or skin reactions like rashes or even urticaria or drowsiness, and then dizziness and liver toxicity, or even like fluctuation in the echocardiogram like QT prolongation, or which can lead to even serious heart rhythm disturbances. So there are many factors that influence these adverse drug reactions. For example, age. So it has been found that the elderly patients, they are more often susceptible to these ADRs, and then polypharmacy. For example, taking multiple medications, that also increase the risk of the interactions of this drugs, and that can also have some serious adverse drug reactions. Then there are genetic factors. Some individuals may be genetically predisposed to certain ADRs, so that can also play an important role in adverse drug reaction. Next is organ dysfunction. Suppose if there are some if there is an impairment of certain organs like liver or even kidney, that function can affect drug metabolism and even the elimination. So there are various diagnoses and as well as management of this ADRs. For example, we have to identify these ADRs, adverse drug reaction, and but however, this can be challenging because it requires a careful review of the patient's medication history, and also it requires a temporal relationship between the drug administration and symptom onset. So therefore, the management of these ADRs, they typically involve several different courses. For example, you have to discontinue the offending drugs when possible, and also you have to provide supportive care and treating the specific symptoms which are showing up. For example, antihistamines. They may be used for mild allergic reactions. If they That can also be one of the cause of one of the side effects of certain drugs. So you have to use antihistamines for allergic reactions, while severe reactions like anaphylaxis, that requires immediate emergency treatment. So you need to hospitalize and take and have some doctors medical emergency situation. You have to check it with a medical doctor. And also reporting and prevention, they play a very important role in this ADR management. So ADR reporting is crucial for pharmacovigilance in many countries, including even in many countries, these healthcare professionals or even the patients, they can report the suspected areas through there are many different schemes in different countries, and there are reporting ADR reporting forms which you can fill with your doctor consent or even the medical practitioner's consent, and that plays an important role in preventing the ADRs. For example, for example, careful prescription is very important in resolving the ADR issue, and especially in high risk patients. And regular medication review is important. Then patients' education about potential side effects is also important. So proper counseling of patient with those drug reviews is they also play a very important role, and using decision support tools to check for the drug interaction. So therefore, you can see that the understanding the ADR is quite essential for the healthcare professionals. And by recognizing the signs of adverse drug reactions, you can manage them effectively and report suspected cases, and we can even improve the patient safety and contribute to ongoing pharmacovigilance efforts. So we have to, it is quite important to note that while medications are crucial for treating many conditions, their use is always their use always carries some sort of risk, and therefore it's important to balance the benefits and the risk, which is a key to optimal patient care. So I hope you like the video, and if you have any question, please put it in the comment, and I will try to answer it. Thank you.